so pleasant about that place. Even your emotions have an echo.
Welcome back to the NutriMedical Report. Alex, I'd like you to tell us about ICBC and the MSP, but I do have a caller in Ottawa, Canada. We'd like to take our callers. Mike in Ottawa, with your question on this topic, go right ahead. You're on the air.
Yeah, Dr. William, just a little different perspective. As in Ontario, I was a WSIB or WCB, whatever you want to call it.
Yeah.
Client about 8 years ago, and they treated me so well. You know, they sent me to the best orthopedic surgeons. They sent me to physio. They made sure my mortgage was paid. They made sure my kids were fed, and they got me back to work. So from my perspective, I don't get it.
Well, it depends on which system and what complaint you had. If you had a simple surgical problem, that's easy. But if you have a problem with a serious multi-organ injury, a closed head injury, if you happen to get in the system, yours was it a very short-lasting condition, or was it long?
Well, initially I didn't know. It was diagnosed as mechanical back injury.
Right, and did they just do surgery and you got well and you got rehabbed and everything?
No, I wasn't considered a surgical patient.
So
well, there it is. It's where there's significant injuries and insurance interest, according to the experts that I interviewed over
there. Yeah, if you got small complaints and it's relatively straightforward, they're going to let those go through. If you've got something that requires five-figure surgery, extensive rehab, chronic pain medications, surgical interventions, multiple doctors.
Very significant financial loss. Let's focus on that. Like
95% of those claims go south. The short complaints like yours, where there's no surgery involved and it's a limited period of time of weeks or months, those usually sail right through without any problem. It's the problem are the big cases, the toxic injuries, the bad burns, the serious multi-organ trauma. Those ones are a death, especially if you've got a closed head injury or spinal cord injury. You're going to be screwed.
Mild traumatic injury.
At the end of the day, it comes down to how much money is involved here.
Exactly. Right? It's as Mickey Spillane says,
I was a very small ticket item.
Yeah, you're sailing in and out. It's like, and not only that, remember, in Canada, which they want to do here in the States, work comp claims are handled by the same billing agency, which is now TELUS for every province in Canada, and they want to then pair that up with software they're developing at WellPoint so they have the same net, and that means your healthcare records are no longer private. A nurse anywhere, whether it's in Ohio or Alberta, working in the oil and gas, or down in Tennessee, or in Florida or Alaska, will be able to log on and get all your records. And if anybody puts something in there that literally disallows you...
Some nurse could know that I showed up drunk one night at an emergency room?
Absolutely. In fact, they can do that right now. Those records are now being made into a virtual record system, and the policies are part of North American Union. You need to know the World ID is a great portion of it is a healthcare ID. With all your medical records, your drugs, your allergies, your HLA haplotype for tissue typing for transplantation, your donor card, electronic donor card, it's all in the system they're developing.
Okay, now you said something scary. Tissue typing?
Yes, in fact... they have policies in Ontario. You may or may not know this. I do know it. That in Ontario and other provinces, they have a policy that if you don't sign a card saying you won't be a donor, you automatically are a potential donor. And
so they can harvest from me if I get killed.
Exactly. And in fact, if you're sitting there, and I worked in Georgia where the vascular and other surgeons were we called the vampires. They would wait around the trauma and burn unit because I was one of the emergency trauma doctors as well as my own private practice. And we had somebody that had a very bad injury. And they would ask us to please pull the plug early, and we would get extra benefits, if you want to call financial and otherwise, if we would do that. And I'd tell them to go to hell. Okay?
Pull the plug early?
Pull the plug so that they could harvest organs.
No, when the guy's room temperature, he's considered dead, right?
No. You have to know the reality. You're living in a Pollyanna world. You're living in a Pollyanna world that doesn't exist.
I was trying to make a bad joke there, sir.
I know. The Pollyanna world. The Pollyanna world you believe in doesn't exist.
I know.
I'm dealing with ugly cases from right now. As an expert witness that you wouldn't believe. I mean, from Indiana to Nova Scotia to Ohio, I mean, unbelievable cases.
Well,
wait till you hear mine.
Something you did say earlier did sort of strike a chord with me. I'm finding that there's very little difference between Canada and the United States anymore.
Well, they want to make it no difference. You see, Canada...
It's like we're one country.
People need to get this, okay? And I'm an American. I was born in Detroit. I was the last few years back in Canada. And Canada has deteriorated further, but it is a communist, Marxist, Leninist country. Okay? It has the most aggressive eugenics program. My wife is still the director of the Nova Scotia Down Syndrome Society, although they haven't got a new head. We've been down here, and we have no intention of going back because I do not like communism. Let me tell you, Canada, everything is a privilege there. Everything is administered. You have no real rights. They can invade your privacy, do all kinds of stuff.
Actually, you do here.
Well,
it's all about documentation.
That's not true, okay? It depends on who you know. That's not true, okay?
My lawyer can beat your lawyer.
The way the law works in Canada is a matter of privilege. It's a matter of privilege, and if you have a lot of money and a lot of connections, you can get away with things. Right. It's very systematically building the system back into the feudal lord system of England.
Okay, one more question before you let me go. This stuff about American soldiers and the suicide rate, what's that all about?
The first off...
SSRIs, right?
Well, the first thing is that they're building more psych units for people coming back loaded to the gunnels with multiple vaccines that are destroying their health, depleted uranium, and aspartame cooked at 130 degrees under tarps in the desert. So their brains are on fire. And number two, the violence of war is so intense, and the horrors that they're doing to the populations of Iraq and Afghanistan, where they've killed 1.5 million Iraqis, displaced 4 million, and made millions of widows and refugees and orphans. It's an obscenity. And I talked to one of my friends who was a senior medic, a commander, Buckley Air Force Base. I've known him for years, and he was a tough guy, an ex-Vietnam medic who was there in some of the most intense battles in Vietnam. And when he came back, all he could do was blubber. He was so shattered as a commander of 450 medics in Iraq.
This is what they used to call shell shock, right?
Yeah, he was beyond that. I've never seen anything like this. As a civilian, I've worked with the military for years. These are hardened people, hardened warriors coming back completely shattered.
And he was sitting in the corner blubbering like a child.
Yeah, blubbering.
Absolutely broken.
Yeah, broken man. And the thing is, he was a believer. He was a good man. And when he went over there, he saw horrors and things like, I'll give an example. The guys, after a while, were kind of flipping out, and these young guys would be sitting up on the roof, and they'd see a woman walking across with her 3-year-old child to go to get some food at the local market, and they decided to just use her for target practice and blow her brains out right in front of her child.
Oh, my.
Okay?
Yeah.
They were using a thing called poppers or directed energy weapons.
I really don't know how to respond to that one.
Well, if you have talked to people who've been in the field of battle, when they come back and they've been vaccinated to death and they got transverse myelitis or organic brain damage or polyneuropathy and they can't walk to the bathroom, when the previous year they could run 30 miles with a 90-pound backpack, scale up the side of a wall, literally like a Spider-Man, and now they can't walk to the bathroom because they've been vaccinated to death, now you've got a real problem. And these troops are coming back here totally destroyed. I get calls literally every day. I got another one this morning, another one going to be deployed in Afghanistan. And they're vaccinating with the first phase of this RNA avian flu vaccine.
Wow.
Yeah, we're comp in Canada and the States. They're making the mistake that they're ready to harmonize with the United States. Harmonization means your rights under the Dietary Supplement Health Act are gone, your total privacy is gone, your doctor's under a, quote, Dr. Mengele Nazi control system. It's absolutely horrifying what they want to do, and they're using Canada as a laboratory to develop this monstrosity. We'll be back in a moment.